Lesch-Nyhan syndrome is a disorder of purine salvage characterized by neurological and behavioral abnormalities accompanied by the overproduction of uric acid. While the disease is extremely rare, it is important to know as this disease is commonly used by exam writers to assess your understanding of purine salvage. I'm going to give you a visual mnemonic to orient you to the facts you have to know about this disease so you'll be ready for any question you might get on test day. This scene takes place in a post-apocalyptic game. These zombies are hungry and they're out for flesh. Yeah, that's right, these guys are flesh eating. By the way, the word flesh kind of reminds me of Lesch, as in Lesch-Nyhan. Our flesh-eating adversaries should therefore anchor you to Lesch-Nyhan syndrome. Now, every game needs a playable character. You know, some relatable person who gets lost in this dark swamp. This time, the character is a hog. What, a hog? Doesn't this hog seem oddly familiar? That's right, this hog is our recurring symbol for HGPRT, or the hog PRT enzyme. And our HGPRT hog is definitely lost, which should help you remember that Lesch-Nyhan syndrome is caused by defects in HGPRT. Recall how HGPRT plays a critical role in the purine salvage pathway, where free purine bases are recycled into purine nucleotides. A defect in HGPRT impairs purine salvage, essentially forcing all these purine bases to be eliminated. And how are purine bases excreted? Via uric acid, of course. To help you remember this fact, check out where you were trying to get for shelter. A yurt high off in the distance. A yurt, by the way, is a recurring symbol for uric acid. A yurt for uric acid, or uric acid. Uric acid is produced as an intermediate in purine excretion, and levels of uric acid are increased in Lesch-Nyhan syndrome. You can remember this high uric acid as our yurt high off in the distance. It should also be pretty easy to reason why uric acid levels are increased in Lesch-Nyhan syndrome. Since free bases cannot be salvaged due to defects in HGPRT, they are instead shunted down the purine excretion pathway, thereby producing uric acid. You can refer to our scene on purine excretion to learn more, but for now, just remember this high yurt to peg elevated uric acid. Okay, so we're trying to get to the yurt, but how are we going to make it there through all these flesh eaters? Well, by using tools, of course. See how our hog is fending off the zombies by using a small cross? Yeah, vampires aren't the only things afraid of crosses. This small X-shaped cross happens to be our recurring symbol for X-linked recessive inheritance. Our hog using this small cross should help you remember that Lesch-Nyhan syndrome is inherited in an X-linked recessive pattern. Got that? Let's move on. Now take a closer look at our flesh-eating friends here. See how one of them is biting his own hand? Flesh at any cost. This picture should remind you of self-mutilation, one of the cardinal symptoms of Lesch-Nyhan syndrome. Children affected with Lesch-Nyhan syndrome will often bite their own digits to the point of injuring themselves. This is super high yield, so I want you to develop a knee-jerk reaction to self-mutilation and Lesch-Nyhan. Just recall how these guys will go for any flesh, even their own, to help peg this fact. Another related finding in Lesch-Nyhan syndrome is aggressive behavior. We don't really need another symbol for this though, as our flesh eaters look pretty aggressive already. Next, take a look at that huge toe on one of our flesh-eating friends. Yeah, that is a big toe. It looks a little bit like podagra to me. Podagra is one of the features of gout, an arthritic condition caused by increased levels of uric acid depositing in tissues. Since we've already talked about uric acid, this should be obvious. Just remember that gout can be seen in patients with Lesch-Nyhan syndrome, and you'll be good to go. Next, notice the clothes on our zombies. In particular, notice the confluence of orange mud around the groin. This picture should remind you of the finding of orange sand in the diapers of babies with Lesch-Nyhan syndrome. In reality, this is just another sequelae of increased uric acid levels. The orange sand is actually just sodium urate crystals precipitating out of the urine. Orange crystals in the urine is important to remember, as this is a finding that parents will notice early. Next, take a look at the posture of our other flesh-eating friend. Yeah, he's got the typical stiff movements and contorted limbs of a zombie, something right out of Thriller. This picture should remind you of the dystonia and contorted limbs seen in Lesch-Nyhan syndrome. Next, notice how it's not just people who've been affected. Even the wildlife have been hit. Kind of like this turtle here. Yeah, this turtle should remind you of developmental delay and intellectual disability. Because what's more delayed than a turtle? Lesch-Nyhan syndrome is classically associated with cognitive disability, a finding you can remember by picturing our turtle here. Or you could just remember that most metabolic disorders have developmental delay. You decide. Okay, so you know how these zombie games are always caused by some sort of superbug. Well, our hog has come prepared with his Purinel sanitizer. Specifically, this is a bottle of allopurinol, which should help you remember the drug allopurinol. Allopurinol is a xanthine oxidase inhibitor, and it helps to reduce uric acid levels in patients with Lesch-Nyhan syndrome. Again, the cause of many of the findings in Lesch-Nyhan syndrome is a buildup of uric acid. Therefore, inhibiting the enzyme that produces uric acid is how we treat the disease. While it won't reverse the neurologic damage, allopurinol can help reduce gout and the formation of uric acid crystals in the urine. But as you probably already know, allopurinol is not the only inhibitor of xanthine oxidase. That's right. Take a look at that fuse box on the yurt. No wonder we're trying to get there. This fuse box can turn the lights on. Light always scares/kills the zombies, right? This fuse box also helps me remember febuxostat, another xanthine oxidase inhibitor. Get it? Fuse box for febuxostat? It's the febuxostat fuse box. Febuxostat also inhibits xanthine oxidase to reduce uric acid levels, and it is another first-line treatment for hyperuricemia and Lesch-Nyhan syndrome. Alright, that's it. Let's recap quickly before we make it run for the yurt. Lesch-Nyhan syndrome is an X-linked recessive metabolic disorder that is caused by defects in HGPRT. This therefore impairs the process of purine salvage, which causes more purine bases to be converted into uric acid for elimination, ultimately resulting in hyperuricemia. Neurologic damage in Lesch-Nyhan syndrome manifests as self-mutilation, aggressive dystonia, as well as cognitive delays. Increased uric acid levels can cause gout in patients and can also precipitate in the diapers of patients as orange sand. Treatment involves the use of xanthine oxidase inhibitors, such as allopurinol and febuxostat. And that's it for Lesch-Nyhan syndrome. You should take a break from studying, or at least turn the lights on. You're starting to look a little bit like a zombie yourself.